My name's Sean Harrop. I'm the current Clinical Haematology Fellow at the Peter MacCallum Cancer Centre, and I'm about to embark on a PhD in the Neeson Laboratory at the Peter MacCallum. My medical career began at Monash Medical Centre, where then I moved to St Vincent's Hospital in Melbourne to complete my basic physician training, and that's really where I developed an interest in haematology and lymphoma in particular. I still remember these patients would come in very unwell, and it would be very gratifying to make them better, and in a lot of cases to cure them. And that led me to do further haematology training and specialise through the Peter MacCallum Cancer Centre and the Royal Melbourne Hospital in Melbourne. And through that time there, again developed more interest in lymphoma and immunotherapy or immuno-oncology in particular. And immunotherapy in diffuse large B-cell lymphoma, which is a subtype of lymphoma, has been used extensively for over 20 years now. But more recently, sort of developments in that area have led to a significant improvement in outcomes for all patients, including patients who would previously had a real dismal prognosis. These were patients that would relapse quite early after chemotherapy. So clearly immunotherapy is a very potent therapy for lymphoma, and I see this PhD, which I'm about to embark on, as a way of learning not only how they work, how the therapies work in more detail, because there's still a lot we don't know about these therapies, but how we can improve upon them and ensure that they benefit as many patients as possible. My PhD is very generously funded by the Leukemia Foundation and the HSANZ, as well as I'm a current employee of the Peter MacCallum Cancer Centre. I think every day in the clinic I get to see patients that have good outcomes as well as patients that have less good outcomes, and my desire is to see more and more patients have those good outcomes, because they are incredibly rewarding. And hopefully through this work we can contribute to more and more patients having those good outcomes. I recently have a 1-year-old son who preoccupies most of my time, but before that running, reading and spending time with my dog.